Good morning. This is Follow the Science Monday morning COVID-19 update. I'm Dr. Paul Juarez. I'm professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College and also principal investigator of the Tennessee Community Gauge Alliance Against COVID-19, also known as Tennessee SEAL. Today is Monday, February 14th, 2022. And today I'm going to provide an update of where we are in the COVID-19 pandemic and provide some projections of where we are heading in the next month or two. I will start by providing an overview of national data followed by current trends in Tennessee. I will then provide some projections based on public health models. And in conclusion, I will discuss some of the remaining issues that provide reason to remain cautious as we move forward. In all 50 states, we are seeing decreases in new cases and hospitalizations. But the rates and decreases we are witnessing across states and within states are decreasing at very different levels. And while new projections suggest that by spring, we should be past the pandemic phase of the Omicron pandemic and entering the endemic phase, there are still a number of factors to remind us that caution will still be needed. Nationally, the 7-day average of new cases of COVID-19 are down to 172,951. This is down almost 80% from over 800,000 cases reported just a month ago. Hospitalizations also are down almost 40% from over 150,000 per day over a 7-day period to 92,650. Deaths likewise from COVID have stabilized and appear to be receding, having dipped below 2,500 per day for the first time in a month. Based on current trends, the Institute for Health Metrics and Evaluation, or the IHME, projects that by March 1st, new cases of COVID-19 nationally will be around 80,000 per day. That's less than half of where we're at today. They are also projecting the number will have again to about 40,000 per day by April 1st. It is unclear, however, where the floor in cases will be, and it is anticipated that the Omicron variant will be with us as an endemic like the seasonal flu for a very long time. In addition, the recent emergence of the BA2 or the stealth variant of Omicron virus or some new variant could prolong the spread of COVID or cause secondary surges. Like the entire United States, Tennessee statistics are trending down, but in an inconsistent fashion across the state. While overall cases, hospitalizations are declining in Tennessee, Tennessee still ranks 5th nationally in total number of cases of COVID-19, reflecting the low vaccination rates and high-risk populations in the state. Overall, the 14-day change rate of new cases of COVID-19 is down by 65% in Tennessee. Yet, all 95 counties continue to be designated as high risk for community transmission by the Centers for Disease Control and Prevention. High is the highest level of risk identified by the CDC. Meanwhile, hospitalizations are down 20% and deaths are down 24% to an average of 0.67 per 100,000 of the population over the past 14 days. Not all counties in the state are yet experiencing decreases in new cases of COVID, however. New cases of COVID are still increasing in 18 of the 97 counties. Counties with the highest increase in COVID rates are Sequatchie at 122%, Unicoi at 96%, and Humphreys County at 50%. 77 Tennessee counties continue to report increasing hospitalizations, led by Claiborne at 134% increase, White at 110%, and Wayne at 88% increases. Counties with the highest death rates due to COVID-19 over the past 14 days are Meigs County at 4.6 per 100,000, Lake at 4.07 per 100,000, Macon County at 4.06 per 100,000, and Morgan at 4.0 deaths per 100,000. Mortality rates per 100,000 of the population from COVID-19 are 6 to 7 times higher in those 4 counties than the statewide mortality rate average. On the vaccine front, the percent of persons in the state who are fully vaccinated remains at 53%, where it has been for the past several weeks. In contrast, counties with the lowest rates of new cases of COVID-19 per 100,000 of the population are Shelby at 38, Lake at 63, and Davidson at 67 cases per 100,000. Counties with the greatest declines in the 14-day rates of COVID per 100,000 of the population are Lake County with a decline of 80%, Lauderdale County with a decline of 66%, and Shelby and Dyer with decreases of 65% over the past 14 days. While national declines in all 3 indicators of COVID, that is, new cases, hospitalizations, and deaths, are trending down, providing support for optimism, there are several factors that still need to be closely watched. First, it is not yet clear if the BA.2 variant of Omicron, i.e. the stealth variant, will prolong the pandemic or reduce the rate of decline in new cases, hospitalizations, and deaths. Second, Pfizer and BioNTech announced on Friday they were delaying their emergency use authorization request to the Food and Drug Administration for their COVID-19 vaccine for children under 5 years of age until early April, waiting on more data on the effectiveness of a 3rd dose. Pfizer amended its clinical trial for younger kids in December to study the 3rd dose after the first 2 doses did not produce an adequate immune response in children 2 to 4 years of age. Younger children will receive a smaller 3 microgram dose compared with the 30 microgram shots that are approved for adults. The CDC plans to roll out 10 million doses in 3 phases as soon as the FDA authorizes the lower dose 3 microgram Pfizer and BioNTech shot for children 6 months to 4 years of age. Children under 5 years old are the last group in the United States that isn't eligible for vaccination. Third, at the local level, there are still many people who have not been vaccinated. Rates vary highly by age group. Counties with the highest percent of the population that is fully vaccinated include Meigs County at 67%, Williamson at 65%, Davidson at 64%, and Maury and Loudoun at 63% each. Vaccinated and booster coverage also vary widely by age, in part because older adults became eligible first, and some younger children are not yet permitted. In addition, booster eligibility depends on the time since an individual's last shot. In Tennessee, Only 13% of children 5 to 11 years of age and 37% of children 12 to 17 years of age are fully vaccinated, while 58% of adults 18 to 64 and 83% of adults 65 and above are fully vaccinated. Similarly, of those who have been boosted, only 2% are children under 18 years of age, 20% are those 18 to 64 years of age, and 55% are adults over 65. Even though the rate of vaccine uptake has slowed down, it does not mean that there aren't still many people who are willing to get vaccinated. Providers are reporting that they have administered about 569,000 doses per day on average over the past 14 days, including first, second, and booster doses. There are many reasons eligible people are not yet vaccinated or boosted. Surveys have indicated that some people are adamant in the refusal of the coronavirus vaccines, while others are open to getting a shot but have been putting it off or want to wait and see before making a decision for themselves or for their children. The first group, surveys have shown, tends to be disproportionately white, rural, evangelical Christian, and Republican. The second group tends to be a more diverse and urban group, including many younger people, Blacks and Latino residents, and Democrats. Strategies that have been demonstrated as effective for reaching those who are still open to become vaccinated include providing vaccines at community events and or by mobile vaccine units. These strategies often have the advantage of being trusted providers and accessible to socially vulnerable people and those who may be skeptical about governmental providers. Well, so once again, that's all for today. Thank you. This is Dr. Paul Juarez from the Tennessee SIL and Meharry Medical College with Follow the Science Monday COVID-19 update. Signing off. Until next week, be safe.